in the Four Corners.
Sure, the 90-Second Naturalist is all about animals and plants, but it's also about us humans. After all, what creature is more amazing? We're the most creative and destructive, intelligent and foolish, loving and hateful beings on Earth. And we've come to have a significant effect, good or bad, on everything we touch. I'm Thane Maynard. Tune into the 90-Second Naturalist and find out how we're interacting with the natural world today.
Listen every weekday afternoon during the KSJE Evening News at 5:30. Ten minutes past 8 o'clock. It is Wednesday morning, the 14th day of May, 2025. Good morning, everybody. I'm Scott Micklin. Thanks for tuning in to KSJE 90.9 FM over the airwaves here in San Juan County, New Mexico. In Durango, Colorado, we broadcast at 103.3 FM. And if you're listening to my voice anywhere else on the planet, you've gone to our website to do that, streaming all the time from KSJE.com. I also want to take a moment to welcome our viewers this morning who are joining us. The video of this program is streaming out live to the KSJE Facebook page and also to our YouTube channel. So welcome aboard, everyone. Glad that you are with us this morning, because coming up, we are talking about healthcare with my guest from San Juan Regional Medical Center. A unique part of healthcare is in addition to that as well. So stay tuned. More coming up in the next few moments right here about that on KSJE. Then we invite you to stay tuned next hour for our Roving with the Arts program. Classical music, of course, with Mick Hess, beginning after the news at 9:06. A special 90-minute version on Wednesdays, of course, because that takes us to 10:30. And right on Four Corners, our local and regional author program with Delcherie Gladden. This week, Delcherie is speaking with author Nan Fisher about her book called Growing a Sensational Garden in the Southern Rocky Mountains. That is coming up today and includes, of course, areas of New Mexico, Colorado, Utah, and Arizona. Stay tuned for that conversation. Perfect timing, I would say, in 10:30 on KSJE's Right on Four Corners. You can also connect with us on X and Instagram in addition to Facebook and YouTube. And if you're a podcast listener, and who isn't these days, you can listen to KSJE Podcasts wherever you listen to podcasts. So check it out, Apple Podcasts, Spotify, iHeartRadio Podcast, Google Podcast, Pandora. The list literally goes on and on. Check it out and discover a new program that you may have missed recently. Outside our studios here at San Juan College this morning, it is currently mostly sunny and 51 degrees. We are expecting some increasing clouds today, and those winds will pick up as well. Today's high about 60 degrees. We could see wind gusts around 40 miles per hour this afternoon, so maybe not quite as strong as yesterday, but still a windy day with increasing clouds today. Clearing up overnight, though, with a low near 40 degrees. It'll be mostly sunny tomorrow with a high of 66 degrees on Thursday. Sunshine 71 on Friday. Partly to mostly cloudy on Saturday with a high of 74. There may be a chance of showers Sunday and Monday of next week with highs from the mid-50s to the mid-60s. So the warm weather is not here to stay just yet. I'll be back with my guest from San Juan Regional Medical Center right after this on KSJE. KSJE is supported by San Juan Regional Medical Center. The caregivers of San Juan Regional Medical Center are committed to bettering the quality of life, health, and care of individuals, families, and our communities. Life is their sacred trust. Better is their mission. Here is their home. San Juan Regional Medical Center, improving the health of the Four Corners since 1910. KSJE is supported by Riverfest, a tropical staycation on the Animas River, presented by the River Reach Foundation, Memorial Day weekend in Farmington. Become a volunteer, work a 2-hour shift, and receive a free t-shirt. Many volunteer opportunities are available, from working at the ticket, merchandise, or information booths, directing traffic, helping with tables and chairs, setting up for the Wiener Dog races. Riverfest, May 23rd, 24th, and 25th along the Animas River in Farmington. Find out more at riverfestnewmexico.com. I'm back in Studio A with my guest this morning, as I mentioned, from San Juan Regional Medical Center. We want to welcome to the KSJE microphones the Clinical Quality Coordinator at the hospital. Nick Maule is here this morning. Good morning. Thanks for coming in.
Good morning, Scott. Thank you for having me.
Good to have you here. And I guess let's start by having you explain a little bit to all of us what the work is that you do. What is a Clinical Quality Coordinator, please?
Sure. Thank you for the opportunity.
Sure.
So in my role as the clinical quality coordinator, what I do is I look at data and I interpret that clinically. So I have a nursing background. With my nursing background, I'm able to look at data and tell if we were doing something right, whether we followed our policies and procedures, and then based off of that, I can interpret that and let the nurse know who took care of a certain patient, how they did or how they didn't, things that we may need to improve or things that we did really well, and be able to tell them good job.
Got you. And so that data comes from a patient's stay at the hospital. So this is once the patient has left, been discharged, you take a look at all the data from when they were checked in and take a look at that and see what it looks like, I guess, right?
Yes, sir. Yes. From start to finish, we look at all the processes, make sure everybody who touched that patient did what they needed to do, make sure that continuity of care started and ended. And then we also look at and interpret the ending and make sure that they were taken care of at the very end. Once they leave San Juan, that's not necessarily the end of their care.
Right.
We also need to transition them into other avenues, other alternatives for care, whether that's physical training or medications that they may need upon discharge.
Gotcha. So just because they're discharged doesn't mean their relationship with the hospital or their caregivers is ended.
Correct.
As you say, it may go into rehabilitation or additional medicines or procedures or who knows.
Yes.
But some follow-up care. And so that's important too. And so you've been doing this for about how long?
So I've been with San Juan for just under 3 years. I started with them in their emergency room, worked with them in the emergency room as a nurse, made my way up to a charge nurse, and then I ended up helping them kind of manage that department. Once I got to that role, I was able to then transition into this role. The person who left this role was able to come and find me, asked if it would be something I would be interested in. I fell in love with the idea of being able to help people directly and also be able to help more people instead of just my individual being with that patient. Yeah.
I gotcha. Right. And so are there others like you that do the same job, or are you the only one that does your job at the hospital?
Yeah, good question. So I'm currently the only one who does this. I'm in charge of stroke,
That's a lot of data.
and MI.
Yeah.
So I collect a lot of data. I'm very fortunate that I have some data collection teammates.
Okay.
And I would not be here without them. They do a lot of the behind-the-scenes work and give me that data, and I help to interpret it.
Gotcha.
But with the small team and myself doing this, we work for all of San Juan and really try to help our community and better our community.
Got you. But you work with those particular types of patients, as you mentioned, then the stroke patients, the sepsis patients, and then the other STEMI patients, which is kind of chest pain, heart problems, things like that, right?
Yes, sir.
Gotcha. So it's not everybody at the hospital. That would be a lot of patients and a lot of data.
Yes,
so
absolutely.
I'd be worried about that. But that's still a lot of
It is
patients
quite a bit.
that are coming in, and pretty seriously maybe ill patients that are coming in with these types of issues.
So these three are our biggest issues that we have at the hospital. They correlate with the most amount of death, unfortunately. They're the biggest issues other than trauma.
Right.
So other than a car wreck, most people are coming in. These are the big serious ones. Other than stub toes and some fingers and a cough, stomach ache, this is really what hospital is about, and this is where medicine gets really serious.
Right.
Everything has to be done appropriately to ensure that these patients are successful in their rehabilitation. I've seen success stories with San Juan that are phenomenal, where patients who have come in who aren't doing very well end up leaving and telling us thank you and walking out. So we do a great job, but we need to make sure that we're following best practice and that we're constantly evolving and making things better for our patients.
Got you. And that explains then the important work that you do to be
Yes.
able to look at those case studies, I guess, and see how things went and how things were good, both the good and the not so good.
Absolutely. Yeah, we interpret both positive and negative.
Right.
Our positive, we look at and we give kudos and make sure that we're telling people good job. And then we also look at the negative, unfortunately, and we peel that back and really dissect that and make sure that we're going in and fixing those issues, making sure that we don't repeat any of our mistakes.
Gotcha. Right. And things like that, and make sure the policies are being followed and
Absolutely.
things like that. The month of May just happens to be Stroke Awareness Month, and so that's another reason why you are here to talk specifically about cases of stroke and things like that, and that is, I guess, one of the three major things that you see at the hospital are stroke patients that are coming in, huh?
Yes, that's correct. And, stroke is unique in the sense that it doesn't normally happen at the hospital. It happens at home or in the public.
Right.
And it's kind of one of those silent things that sneaks up on you. And you can be walking down at the river walk that's coming up soon and be just fine, and all of a sudden drop your drink and not be fine. And so the earlier that people around you can help identify that and detect what's going on, the faster that we can treat you, and then the better your outcome's going to be.
Right, exactly. And so talk to me a bit about some of those, as long as we're talking about stroke, the warning signs and things like that, because I know there's some things that folks can be watching for.
Yes.
Even the person maybe who's having the stroke can be
Yes.
aware that something isn't quite right. I would hope so anyway, right?
Absolutely. So we utilize the BFAST acronym.
Okay.
And with the BFAST acronym, we're wanting patients to look for their balance, their eye movement, their face, their arms. We're looking for their speech and their time. So for your balance, if you start having any type of balance issues, anything that you were coordinated and all of a sudden become uncoordinated, that can allow people around you as well as yourself to know something's not right.
Right.
We need to kind of take this seriously. Eyes, you may be looking at somebody but not actually absorbing anything that they're saying, or while somebody's talking to you, you may not be paying attention to them directly. Your face, you may have a droop on your face, and that I think is a really common sign that people identify as stroke.
Sure.
But that would be part of it. Your arms, so if you have a patient stick both of their arms out, it's a father, you tell him, hey dad, stick your arms out. If one of them starts to drift, that might be a sign of stroke.
Okay. And the patient may not know that the one is drifting, I guess, too.
Correct.
Is that the idea,
Correct.
right?
So that's why somebody else would want to ask
I'm
you to hold
holding
your
him
arms
steady,
up.
but you're really not.
Yes.
Okay.
Speech, you may start to slur your words. You're not making sense anymore. And then time. The time is really important because we want to know, when did it start? Once we get you to the hospital, we have medications and interventions that are really specific off of that time of when it started. So if you have people around you, really remember to try to take that time down and then inform healthcare workers as soon as you can, and that way they can then interpret that data and determine whether we can intervene or not.
The paramedics, the ER folks, whomever you're
Absolutely.
come in contact with. So that's important because I guess, as you said, right, the amount of time that you have suffered the stroke determines maybe the type of treatment that you might get once you get to the ambulance or the
Yes.
emergency room.
Yes, and the longer you're potentially in a stroke, the more damage it's creating, and so
Right.
we want to get that eliminated and rectified as fast as possible.
Sure, because a stroke is, what's going on with a stroke? It's really some type of a blood problem in the brain.
Yes, absolutely. So there's
Explain it better than I did, please.
There's two different types of stroke. So we have ischemic and hemorrhagic.
Thank you.
Ischemic stroke is a blockage, and so a hemorrhagic stroke would then be the bleeding in the brain.
I gotcha.
So both of them end up filling an area that shouldn't be filled.
Both impact the brain.
Absolutely.
For sure.
And so both of them end up causing deficits.
Mm-hmm.
They're treated differently. If it's a clot, an ischemic stroke, we end up using a medicine. And if it's a hemorrhagic, that is treated differently.
Sure.
We consult with UNM on all strokes, and we either end up keeping you here based off of their recommendations, or we end up flying those patients out to UNM.
Gotcha. And I know each condition, each case is different. So,
Very, very unique and subjective.
but that's important. That's why getting to medical professionals as quick as possible is so important, to be able to evaluate what exactly is the extent of the damage or whatever's going on up there, because the brain is a really delicate organ,
Yes.
and while it's an amazing thing, your ability to recover also may depend on how quickly you are seen and get treatment.
Absolutely. And we have unique ability to look with different scans and diagnostic tests
Right.
to identify that as quickly as possible.
Sure, which is really important as
Yes.
well. And stroke recovery, I think there's been a lot of gains in that, or it seems like people are being able to regain a lot of maybe what they lost during a stroke or after a stroke. Is that true?
So it looks like we're doing a lot better with this, yes. So with the hospital, our continuity of care, like we talked about in the beginning, it doesn't end with San Juan. And so we really try to follow those patients and make sure that rehabilitation is going well. We have a rehabilitation center that's associated with San Juan on our campus that we can direct people to, and they work with those individuals to ensure that. A lot of those individuals have reported that they were able to get back to their life and have a lot more semblance of what was normal to them before.
Gotcha. And so going back to the work that you do as the clinical quality coordinator, when you get a case from a stroke patient, or any patient really, right, you are looking at what happened, what took place, and things along that line. And so you follow them all the way through, even maybe after discharge. Is that how extensive your analysis is?
That's correct. And then even days afterwards, if they, we'll end up consulting with UNM if they end up going to UNM.
Right.
We also utilize telemedicine. And so based off of those telemedicine, we'll get reports from UNM and kind of what their diagnosis was, what they saw, and then we'll interpret that data as well and put those together and kind of see, are they saying the same things that San Juan is saying? Is there anything different? Was there something that we did that was really good? Is there something that we could have done better the next time? And so yes, there's a lot of information that we gather to make sure that our patients have the best care at San Juan as possible.
Right. And so I guess it's conceivable that from the work that you and your other colleagues are doing, that maybe some policies may change at the hospital if you come to them with enough evidence that says, you know, if we did this differently, maybe this outcome might be better.
Absolutely. So as long as
And they're open to that?
Yes, as long as we're putting everything into science and looking at best practices, we constantly are wanting to evolve those policies and procedures. We're always wanting to make them better. If we find any potential for better avenues through these policies, we will absolutely adopt those and utilize those and then implement that. Got you.
And I know, and on this program, we've talked a lot about kind of the whole education and the environment at the hospital, where there's a big training program to bring everybody kind of on board to working and going in the same direction, from the folks that work to deliver the mail, to folks that clean the floors, to the surgeons, to the doctors, to the nurses, to everybody. It seems like there's a whole kind of concept of working in the same direction. And this all follows with what you do, I guess, too, is adding to that whole education.
Correct. I think the hospital as a whole is a constantly evolving educational institution, and we're always trying to be in best practice. We're always trying to evolve. And then we're also getting ready to become a residency program for MDs and nurse practitioners or advanced practice individuals.
Right.
And so with that, we're going to constantly be bringing in more education and constantly be evolving and constantly be getting better, hopefully, with the best science.
Gotcha. And that's very exciting.
Yes, it's very exciting.
That program that you spoke about, and that is coming together, it sounds like, and so it's heading in the right direction.
It's a work in progress, yes.
Right. But I guess, again, if you're going to be that type of a facility, you want to have those best practices ingrained in your program and in your staff and your treatment plans and all those things to be able to then teach these newer folks who are coming in to learn from you.
Absolutely. Students create challenges, and challenges create better outcomes.
Right.
And so that's what we want. We want to be challenged, and the more that we are challenged, the better that we will become.
Gotcha. And so with your job, talk to me a little bit about some of the things maybe that folks wouldn't maybe not be readily available or understand of what you do with the work that you do, because you're not necessarily working with patients one-on-one. You are dealing with them after they've left the hospital. Is that the idea?
So I don't directly work with any of the patients. Mm-hmm. What I do is I look at all of their data and interpret that.
Right.
Based off of that, if there was anything that we needed to do, I would help with our education. We also have an emergency room educator, so each unit has their own educator. I would then get with that unit educator. We would talk about things that we could do, maybe some educational things, maybe some games that we need to incorporate to help educate and learn. We would also look at things that we were doing wrong and see if there's a process or a procedure that we need to change. Was it because of a unique or subjective situation that we ended up doing something outside of our policy? So we look at all of that, we take all of that information and we interpret that, and then based off of that, make sure that the individuals who are responsible for it know how they were doing, positive or negative.
Right.
It makes us better to know. And also, when we have a stroke and you're in an emergency room or you're on a unit, you may not be able to follow that patient. So it's really good sometimes to come back to that nurse and tell that nurse, hey, in the very beginning, you did this. That ended up getting this patient out 3 days later, and they walked home, and I just wanted to thank you, how good of a job that you did. And so sometimes it's just me coming and telling that nurse, you did an awesome job, or going to the physician and telling them, hey, thank you for what you do. We appreciate you here at San Juan. You did a great job. And so sometimes my job is really easy, and then sometimes it's really hard.
Right. Well, like most jobs,
Yes,
I
sir.
would say too, but that's got to be very rewarding, though,
Absolutely.
to be able to see those moments and share that with these individuals who may not know the impact that they made. They may have thought they were just doing, well, they are just doing their job, but doing just a simple part of their job, but it turned out to be a very maybe life-changing
Yes.
thing for that patient.
Very impactful, and sometimes you don't realize how impactful you were.
Right, which
Yes.
is exciting. And as we talked before we came on the air this morning, it can be very complicated because some patients may come in with several things going on at the same time. And so it's not just a stroke or it's not just a heart attack or what have you, but it's multiple things. And so that complicates the care and the treatment and brings more people into the equation too.
Yes.
More data for you, I guess, to look at once
Yes.
they're discharged.
Yep. So very rare cases we'll have patients who will come in with a certain ailment, and then
Right.
while they're with us, they may actually have some underlying issue as well, and then we end up finding that while they're hanging out with us. I also work with sepsis, so we may end up finding a patient like that who is becoming septic. With stroke, that can happen also, and so you may come in for a bellyache, and while you're with us, you may end up having some sort of a stroke issue, and so we care for those also in that real time.
Right.
And it's not always something that happens out in the public. It
Sure.
definitely could happen with us while you're already here, even though you showed up for something different.
Right. And so with things like sepsis and other things like that, I mean, that can then deteriorate pretty quickly if you don't catch it. Isn't that the idea?
Yes. Yeah, sepsis is a big one. Sepsis is something that it happens very rapidly. It can be masked as a bunch of other things. And so sepsis is, in my role, it's a very unique piece of it, and it's a very hard one because it's very subjective. There's a lot of moving pieces to it, and a lot of people have to be involved to help with a
Right.
septic patient.
But it seems like every hospital, every healthcare facility is, excuse me, watching for that too because
Yes.
of the danger it can bring.
Yes. Yeah. The big three: the sepsis, stroke, and MI, and then sepsis because it's the
Right.
most silent.
Got it. And the other one, the third, is the heart. And talk to me a little bit about some of those cases too.
So MI, STEMI. So STEMI is your heart attack.
Right.
So you have your ST elevation, myocardial infarction. With that happens a lot while you're out in the community.
Sure.
EMS usually responds to those, and our EMS unit is phenomenal. They are able to identify that in real time. They're able to then radio it to us. As soon as you get to our facility, we've already started kind of the work in the background before you even showed up. We've already gathered with cath lab. They know what's going on. Our physicians are already got an EKG from our EMS. They've sent that over to a cardiologist, and they're interpreting that. So hopefully everything went well by the time the patient actually gets to our doors at San Juan. They're able to bypass our emergency room and go straight to our cardiac cath lab.
It's another one of those cases where time is of the essence.
Absolutely. And we just actually recently had a case last month where that whole process went down, and it was about a 12-minute once they hit the back door to being completely out of their STEMI and having a balloon placed in our cath lab took 12 minutes.
Wow.
And so it was phenomenal. But these are the processes that everything goes well, it looks great. If we have some sort of an issue, that's where I gather this data
Sure.
and I go interpret it and say, hey, there was an issue. We could have been at 12 minutes, but we were at 14. What do we got to do to get back to 12? And so we do phenomenal work, and everybody who's involved is really good at working together.
Right. And by looking at that data, as you say, you can kind of determine, I guess, what the average is at the hospital for dealing with these types of patients. And I know every patient is different, and everyone, comes in with different, unique healthcare needs. But again, having some of that data is helpful, I guess, to look at to say of all of our heart attack patients, this was the average time it took us to get them into the cath lab or whatever to start treatment.
Correct. Absolutely. And so based off of those statistics, we're able to then make improvements or kind of keep it where it's at and say, don't change it, it's not broken, we're doing really good here.
Gotcha. And you can compare that, I guess, with other healthcare facilities across the country, and maybe when it comes to things like accreditation, is that something too that those folks would look at as well?
Correct. And so on a statewide, we are always being looked at from other hospitals in our state.
Sure.
And then based off of that data, we are compared. And so we're always trying to meet certain metrics, and we are usually really close or just above. It's a constant subjective thing where we're always trying to meet those. And based off of that, we are going to become a stroke accredited facility, hopefully in 2026. We're going to start doing that process. Once we become a stroke accreditation facility, we have metrics that we have to follow on a national as well as state level. And so that really keeps us at a high level, functioning as a hospital specifically for stroke, and knowing that we're meeting the metrics to better our community.
Got you. And that is a decision that the hospital has decided to go for, to become accredited when it comes to stroke care and things like that?
Correct, yes. That's something that we're working on. Currently, we are doing chest pain accreditation. We are becoming a chest pain accredited facility. And so once we complete that, hopefully here in October, we will start the process for stroke accreditation and hopefully have that completed in 2026.
Gotcha. Very exciting. And a lot of folks who may be listening to us may be wondering, gosh, why is the hospital going to all this trouble to get to these additional accreditations or put this extra work into really identifying all these different minute details of a patient's visit or things like that. But I think what we forget is sometimes this is a regional medical center, and so it is seeing patients from throughout the 4 states, not just the greater Farmington area and San Juan County, but you get patients from all over. And
Absolutely.
So it is a healthcare facility that branches far beyond the county lines, the state lines, and I think that's maybe something to remember in cases like this, that you're seeing a lot of different patients from a lot of different areas with a lot of different lifestyles.
Absolutely. Yeah, all the way from Chinle, Arizona, we'll have patients come in. And so, yes, we have a huge demographic that we care for. And we see a lot of different things. And San Juan's able to manage most of those here, which is really good for our community. When you look at, you're having an emergency, you get flown over to another facility, and then you're trying to get back home afterwards.
Right.
If you get to stay here in your community, it's easy to get back home once you're done.
Right.
And so we try to do that. We try to keep our community here and take care of them here in-house.
Sure, exactly, which is important. But again, if there's something that there's an expert somewhere else, there's no hesitation to get them to that facility either,
Absolutely.
I'm sure. So that's important as well. Well, Nick, I appreciate you coming in this morning. Is there any final thought that we need to share with the audiences before we run out of time this morning?
Scott, thanks for having me. I do want to talk a little bit about low blood sugar. I think
Yes.
that's a big issue in our community, and it can mimic strokes.
Okay.
It's a very serious and urgent matter.
Right.
And so if you see somebody who's experiencing anything like stroke-like symptoms, make sure that you bring them to the emergency room, because it could not be a stroke. It might also be low blood sugar. And that's a huge medical emergency. So if you have anybody who may be having seizures, low blood sugar, migraines, or Bell's palsy, which is where your eye kind of starts to shut on you, it'll...
Okay, like flutter or something a little bit? Yeah, okay.
Those are things that you want to come to the hospital for, just to have it looked at and make sure that we are ruling out anything that's serious.
Got you. And does that relate also to the prevalence of diabetes in the area too? Is that also part of that, or is it a separate issue?
That's more of a separate issue.
Okay, gotcha. But important to be aware of that.
Absolutely.
And of course, as we said, May is Stroke Awareness Month, so it's important to be aware, not just during this month, but every month, about the warning signs for stroke, and to be aware of those as well.
Yes.
Very good. Nick, thanks for coming in. Thanks for the work that you do to keep us all healthier.
Scott, thank you for having me.
You bet. Great to have you here. That's Nick Maule. He is the Clinical Quality Coordinator with San Juan Regional Medical Center. My guest here this morning on KSJE. KSJE and the San Juan College Native American Center present the Student Study Tip of the Week.
Hi, my name is Latoya, and I'm coming to you with the study tips of the week. It might be easy to fall into a trap of stressing yourself out while you're studying, but that will be counterintuitive in the big picture. You can control when you study and how you study to prepare you for your exams. After that, you have to be confident and try your best to retain the information. Believing in yourself and trusting that you've got this can help you forget about the stress and focus on moving forward. Positive thoughts, positive action, positive outcomes.
The Student Study Tip of the Week is presented by the San Juan College Native American Center and KSJE.